north of 60. I'm Heidi Schweighofer. Today my guest is Dr. Seth Willen, an ear, nose, and throat specialist at Western Reserve Hospital. And our subject matter is hearing loss. If you've noticed that the television is a little bit louder, or that someone in your presence is constantly saying, what, you might need to see someone like Dr. Willen. So we're going to talk about hearing loss and all the causes and treatment. Dr. Willen, thank you so much. I'm speaking from some experience with the TV getting louder. So tell me a little bit, before we begin talking about hearing loss, tell me a little bit about you. How'd you get into this business?
Thank you for having me. So I am originally from Cleveland and went to medical school at Case Western Reserve here in Cleveland. Did my training in New York City and practiced there for a few years and then returned to the area. So I'm a native Ohioan, and in medical school I first developed an interest in ear, nose, and throat, not something that I was exposed to very frequently, but realized that in the field you can see both adults and children and be exposed to both medical and surgical practice. So lots of different avenues within the specialty that you can take.
Sure.
And I was excited by, the ability to be exposed to all of those things.
Now, you are now at Western Reserve Hospital in Cuyahoga Falls.
Correct.
And you've been there for a while?
About 4.5 years.
Oh, all right. And you're a Hudsonite, or you live elsewhere?
I live in Chagrin Falls, a little bit further north, but not too far away.
No, good. All right, now we're going to talk specifically about hearing loss. So let's talk about starting with the causes. I know there's a variety of reasons why it happens.
So there are quite a few different causes of hearing loss, some of which are more applicable to younger patients, to children. In adults, there are some very common reasons why people develop hearing loss. The most common reason is what we call presbycusis, which basically is the type of hearing loss that we see in older adults. And we don't know what the exact reason why that occurs, but we believe it may be due to some structural changes in the inner ear. There are some very fine cells in the ear that are responsible for picking up sound and transferring it to the brain. And those may accumulate damage over time. We also believe that there can be some changes in blood flow in the inner ear, which may be responsible for that. So this form of hearing loss is the most common, and there are many other forms. For example, people who have worked in industry, if they work in a steel mill or in construction, with or without hearing protection, may develop some hearing loss. And there's a specific type of inner ear cell that can be damaged as a result of chronic exposure to sound. So that's a very common form of hearing loss, and that may be seen in combination with presbycusis, with the usual form of hearing loss. And then there are other forms of hearing loss which are less common. For example, there's something called sudden sensorineural hearing loss, which is fairly unrecognized by the general public, but something that we see fairly often in my specialty, where people suddenly develop hearing loss, usually in one ear.
All of a sudden,
all of a
literally.
Sudden,
oh my gosh.
Is defined actually as a loss of about 35 decibels or more, which is significant and can occur over a very short period of time, anywhere from a few hours to a few days. And that form of hearing loss can be quite traumatic.
Oh my gosh, yes.
Yeah.
And there's no warning at all, it just happens.
Sometimes there is, sometimes there isn't. It can be accompanied by an upper respiratory infection, sometimes with things like influenza, but it can actually happen completely on its own with really no warning.
Oh, good Lord.
Yes.
I wondered about viruses and about infection, because I mentioned to you my father-in-law had scarlet fever as a child and had lost hearing at least in one ear, if not, I can't remember how much in the other. Is that uncommon to have it connected in some way with a virus or infection anymore?
In children, some infections have become less common because they're more readily recognized and treatable. There are certain viral infections that can still occur in children, which we may not be aware of until they have their newborn hearing screening test. In adults, we don't see bacterial infections being responsible for sensory hearing loss, but viral infections, we believe, still can be responsible for hearing loss somewhat suddenly.
What about high blood pressure? I hear that as untreated, I should say, high blood pressure. Is that truly a reason for loss of hearing as we get older, do you think? Is it a blood flow issue that you were just describing?
It could be. So that probably falls more in line of general health. So, we believe that damage to the inner ear could be due to vascular changes. So high blood pressure certainly is a form of a vascular change. And so that may contribute. It's not as directly contributing as some other causes, but it probably falls in line with general decline
overall
in health and in hearing that most people experience.
For the boomers, of which I am one, what about listening to really loud music for much of our teen years and 20s?
Sure.
Is that truly, I always attribute it to some of my husband's hearing,
right.
But is that truly like the steel mill?
It can be. Noise exposure obviously is a major cause of hearing loss. The thing about exposure to noise is that you can develop a temporary hearing loss. So people will tell you they've been to a loud rock concert and their ears are ringing or buzzing for a while afterwards. Yes. And that's what we call a temporary threshold shift. So that's something that can be temporary and you can recover from that completely. However, if the exposure is chronic or repeated, then you can develop a permanent threshold shift. And that is a long-term loss of hearing. So that's what you see when somebody has been working in a noisy environment for many years. And it's the same process, maybe not as chronic, but listening to loud music over many years certainly could be responsible for some hearing loss.
Okay. So you've described something that seems like it's just going to happen to every person as they age. Is that correct? Is that what I'm hearing? At some point, I will develop it, however little or big.
Sure. It's not everyone. So what the statistics that I've seen are that between about 50% and 2/3 or 67% of older adults will develop hearing loss, but it's not everybody. So it's not totally straightforward.
Okay.
There are certainly genetic factors that are responsible. So if you have family members, parents, siblings who have hearing loss, you may be more likely to develop it. But also, your history of noise exposure, and there are other factors like exposure to certain medications, certain drugs can cause hearing loss. So it depends on the patient. It's not everybody. There are people who are young who have hearing loss for a certain number of reasons, and there are older adults who have excellent hearing. So it's not everybody.
You must be like a detective then when you have someone come in. What is the first thing you notice, or I don't know how to phrase it, the first thing that a patient would say to you, I don't hear as well as I used to, or, and then what do you have to do? Do a whole medical history, obviously,
Sure.
But how do you go about figuring it out, I guess?
Right. So most patients come in and will tell you that conversations are tailing off, or when people talk, it sounds like the end of their sentences are tailing off somewhat. So that's a very common complaint. When you see a couple, when you see spouses come in together, one will often say that the other one has difficulty hearing them or they're mumbling.
Yeah.
So that's very common.
Boy, that's familiar.
Sometimes family members will be the ones who are telling the patient that, you're having difficulty hearing me. And so we see that all the time. Sometimes people just turn the TV up a lot, and their spouse will tell them your TV, is very loud. So that's the most common thing that we usually see people come in with. You certainly have to do a complete medical history. That's where we start. We always ask patients about their family history of hearing loss, history of noise exposure, history of medication treatment. There are some antibiotics, for example, most of which are no longer used, that can cause hearing loss, that can cause a permanent loss.
No kidding.
Yes, but most of these are not used as commonly anymore as a result.
Good.
And then there are some other medications like chemotherapy drugs, which are still certainly used, that
Sure.
can cause hearing loss.
Permanent hearing
That can
loss.
cause permanent hearing loss, yes.
Do you tend to get more patients coming in saying, this is what I notice, or more spouses or family coming in saying, this is what I notice?
I think it's
or
both.
6 of one, half dozen of the other?
I think it's both. You'll see all of those things.
I think there's some denial that some people.
Absolutely. You'll see a lot of patients who come in and they'll tell you, well, my children are telling me that I have difficulty understanding them. They don't actually say that they have an issue necessarily. But most people understand pretty soon that there is an issue. And that is something that is determined based on a hearing test. So,
tell me a little bit about the hearing test.
Sure.
Because I remember doing something at some point in my life that was with sounds and someone in another room. But that's
Right.
all I remember, so it wasn't.
Right. So hearing tests can take different forms. You'll often see screening hearing tests, which may test a few frequencies. So for example, there are certain regulations for people who work in industry who need to have their hearing tested, and that's done by OSHA requirements, occupational safety, health administration requirements. And then some pediatricians do screening testing. That's very common to be done in kids.
I remember that.
And that's sort of a portion of an audiogram. So what we do in our office and what most licensed audiologists will do is what's called a full audiogram. And that's a test that's designed to measure how much sound is necessary for somebody to hear certain frequencies. And most frequencies are within the range of where most humans can hear well. We don't test every frequency. There are frequencies well above that range that we don't usually concern ourselves with. But you test a certain set of frequencies, and that portion of the test is called pure tone thresholds. And what that is the exact amount of sound that a patient needs to be able to hear something. So if you need more sound, that number is higher, and there's a curve that you see on the test that actually is measured against the frequencies and how much decibel level is needed. So that's the first part of the test.
All right.
Secondly, we test what's called speech discrimination, which is it's similar to pure tone thresholds in terms of how much sound does somebody need, but that portion of the test is actually testing whether somebody can hear, process, and repeat a word, which takes a little bit more brain power than just, whether you hear a specific noise. And then finally, we test what's called tympanometry, and that is the pressure curve of the eardrum. In other words, does that eardrum have a normal pressure curve? Does it respond to changes in pressure correctly? And that is used to sort of determine if there is fluid behind the eardrum or if there is a perforation or a hole in the eardrum. And that is all put together to decide what is this patient's hearing functioning.
Do you notice, particularly with older people, do you notice any psychosocial kinds of changes in their life? Am I making that? Do I sound? You understand what I mean?
I think sort of asking about cognitive issues and things like
yes.
that. So, as we age, there's an increased risk of hearing loss, and there's also an increased risk of cognitive decline. And so, what people have been interested in are those two things related?
Yes.
And we believe that they are, to a certain degree. The exact link is not entirely clear, but we think that people who have difficulty hearing tend to find themselves more isolated. They feel like they're not able to participate in conversations as well. They feel like they're lonelier basically.
They can't go out in a crowd because they can't hear.
Right.
Yeah, I noticed that.
So that's a very common concern. And we think the reason why is that people who are not hearing as well are using more of their brain power to process sound, and so it's taking away from other things.
How interesting.
Yeah, yeah. And we also think that, you know, when the nerve is not working as well, when the hearing nerves are not functioning, the brain is not being stimulated as well. So that may also lead to a decline in some cognitive function. So there certainly is a relationship there. Exactly to what degree is not clear, but there's a lot of studies that have gone on demonstrating that the worse the hearing is, the greater the risk of cognitive decline.
I read something similar with Alzheimer's patients,
Right.
that while there wasn't a direct link, there seemed to be some link.
Right,
Makes perfect sense to me.
right, right.
All right, so now we're all going to have this happen to us. Thank you very much for my glowing future. And
Not everybody.
maybe I'll be in that, 15% or whatever. Tell me, let's talk treatment.
Mm-hmm.
And one of them that I really am curious about, because I've only heard about it, I have never seen it, or I know nothing about it, is cochlear implants.
Mm-hmm.
So talk treatments and talk cochlear implants.
Okay. So obviously you need a complete evaluation. We need to make sure that we're not dealing with a problem that can be treated, because in certain cases you can treat a reversible issue, like having fluid behind the eardrum or having a hole in the eardrum. There's other conditions that I should discuss too that can be treated surgically in some cases. But when we're talking about the standard presbycusis, or loss of generally high frequency hearing, the main treatment is a digital hearing aid. And what those are a device that accepts sound through a microphone, processes it digitally so that it gives a patient back increased volume in the areas where they're losing some hearing, okay? As opposed to just a device that makes everything louder.
Oh, it doesn't make everything louder, is what you're saying.
It's designed and programmed specific for a patient. So it's designed to give the patient what they specifically require in terms of hearing loss.
I never knew that.
Yeah.
So they could differentiate between someone who can't hear in a crowd versus someone who can't hear music.
Right, so there's different patterns of hearing loss. Most people have high frequency hearing loss. That's where most people lose hearing. It's at the higher end of the range. But some people have hearing loss in the lower frequencies. And so what you have to determine is where exactly is the loss occurring. Mm-hmm. And so that hearing aid is not just making every one of those frequencies louder, but it's making the frequencies louder where people are having trouble.
I never knew that.
Yeah.
Ever.
Right.
Because it seems like now this is 10, 20 years ago, people were always dialing it up or dialing it down.
Sure.
Or this is my in-laws. And I thought that just was too much or too little. Mm-hmm. But it's very different nowadays, clearly.
Well, digital hearing aids have probably been around for a while now, but they do have the ability to process the sound specific to the patient. Correct.
Awesome.
And that's a lot of the reason why they're so expensive. We can talk a little bit more about what things are changing with regard to expensive hearing aids.
I do want to talk about that.
But that's why a hearing aid isn't simply just a microphone or an amplifier.
I learn something new every single day. Now, let's do this cochlear implant thing.
Right,
just
so
because
cochlear
I'm
implants.
curious, and then we'll go on to hearing aids.
Sure. So a cochlear implant is actually a device that contains an electrode, which is inserted directly into the inner ear, okay, surgically. And what it does is it directly stimulates the cochlea, or the nerves within the inner ear. And that is generally for patients who are either deaf or have a very, very severe hearing loss. So if somebody does not obtain benefit from a hearing aid, if the hearing aid does not function for them, in some cases they are a candidate for a cochlear implant. This is often done in very young children who we know are born with a certain degree of hearing loss. It can also be performed in adults. And there are some tests that you do in somebody with severe loss who don't respond to a hearing aid that can help determine if they would be a candidate for a cochlear implant.
And then it's a permanent affixation to your
To
head,
the skull, right.
To the skull.
So there's an external microphone which picks up sound,
Yeah.
and that transmits sound to the electrode, which is directly stimulating your cochlea.
How fascinating.
Yeah, yeah, and they can be pretty remarkable. In some patients who are otherwise deaf, they can obtain a cochlear implant. There's a very long process involved in adjusting it for that patient specifically.
Sure.
It requires a lot of rehabilitation, but a lot of patients, up to 80% of patients, can actually use a telephone once they have an appropriately adjusted cochlear implant.
No kidding.
Yeah.
And just to hear voices of their loved ones
Yeah.
and family.
Right.
Oh my gosh.
Right.
All right. Very, very, now, see, we got to start moving into hearing aids because we're running out of time.
Sure.
Not yet. All right. Now, here's what I want to know. How do I go about then? I need one. You've told me I do. What happens next? Do you give me a prescription?
So the question about whether it requires a prescription or not, hearing aids have to be distributed by a licensed audiologist, okay? In the Federal Drug Administration, or the FDA, actually suggests that a patient is seen by a physician, specifically an otolaryngologist, if possible. However, it does not require that the patient sees a physician. Under 18 years of age, they do. So that's pretty standard. In Ohio, hearing aids are distributed by licensed audiologists who perform a hearing evaluation, and if they feel that there's a medical issue, they then refer that patient to someone like myself, to an otolaryngologist for a further evaluation. So from that point of view, you do need a prescription in the sense that it's being given to you by somebody who has done a full evaluation. I believe that an audiologist can sometimes, you can waive your need to go see a physician in that case, but generally most audiologists will refer you to a physician if they feel that there's a treatable issue or there's something else that needs to be investigated. For example, if you have fluid behind your eardrum, or you have a perforation, or if you may have a asymmetric hearing loss,
Okay.
which can be a concern. The FDA has since changed the rules where now people are going to be able to purchase something called an over-the-counter hearing aid. They are not available yet, I don't believe.
What a bad idea that sounds like.
Well, it depends. For somebody with mild hearing loss, that may result in significant savings in terms of
I
obtaining
can just
hearing
walk
aid.
into CVS and get one and slap her in and hope I can hear.
Yeah, and I'm not sure where those are going to be available yet because I don't believe they are. But generally, it's important to see somebody who's a licensed professional.
I would think so.
And then this is a market, this is a business, and so hearing aids vary widely in terms of cost. It's generally advisable to shop around, but there are both independent audiologists who sell hearing aids that are quite good at that and have been doing it for a long time. There are also large marketers that also have licensed audiologists within their stores who can do the same thing.
I think that was one of the most surprising things that you've said today, because I truly believed that if I had hearing loss, I would see a physician and the physician would test and find out what would help me, and then I would go with that recommendation to a hearing aid place. I didn't know that I could sort of circumvent going to a physician and just walk right into a hearing aid store and say, hey, I think I need one.
Right. Well, it is state dependent. In Ohio, the law basically states that somebody needs a licensed audiologist to perform a full hearing test, and if there are any concerns that require evaluation by a medical professional, they will be referred.
Okay.
So we see that frequently. There's
Okay.
lots of audiologists who we work with who
Okay.
refer us patients. And sometimes we find an issue that needs further evaluation.
A medical issue that they couldn't have seen or treated.
Correct.
Okay.
That they may pick up on
Yeah.
their hearing test. And there's a certain period of time that you have to trial that hearing aid. I actually reviewed the Ohio law, which shows that it's 30 days. So during that period of time, you have the right to return the hearing aid if you decide not to keep it. And those are to protect patients and to protect consumers.
Sure, sure.
Right.
We have very little time. I want you to tell me if maybe you don't know this, and I don't, but my understanding is many of the viewers of this show are Medicare recipients, or we have Medicare supplemental insurance.
Sure.
Does Medicare cover the cost of a hearing aid? It covers a visit to you and whatever you think is necessary medically or surgically, but does it cover then the cost of a hearing aid?
So your standard Medicare Part B, I guess you'd say,
yeah.
Medicare itself does not cover the cost of hearing aids
wow.
in any form. However, there are certainly lots of Medicare supplement plans that do provide a benefit, and also a lot of other private third-party payers. If there is another insurance, they are starting to provide coverage. It may be partial. It may not cover the entire cost of a hearing aid, but it may significantly reduce the cost to the patient.
They're quite expensive, are they?
And they certainly can be.
Yeah.
The range can be, from a few $1,000s to many thousands of dollars.
Oh my word.
So they are expensive, but what's happening is that a lot of supplement plans are covering part of the cost. Third-party insurances are in some form covering the cost. And like I said, in some patients, with a mild hearing loss, they may be able to circumvent that whole process by purchasing something on
at
the market.
Costco.
Yeah, at Costco
Yeah,
or at
okay.
BJ's or Sam's Club.
Okay. All right. I just had one more question pop in and out of my brain, and if I can think about it in the next 20 seconds, I'm going to ask you. And here it is. So you see on television ads for little tiny bitty witty hearing aids, and then some that have a wire and all. Is there any difference in type? And I know you have like 1 minute to answer that. Does size matter?
So hearing aids can be behind the ear, which are the sort of classic large
Yes,
hearing aid,
that's
and then
what
there's very small ones, and it depends on the patient's needs.
Oh, okay.
So a hearing aid behind the ear is generally able to be vented more easily. It doesn't get occluded by earwax or by moisture, and it can provide a lot of gain, so it can increase the volume significantly. Some of the very small ones that fit in the ear canal may not be appropriate for somebody who has a severe hearing loss or who has obstruction from earwax or something of that nature.
Can you wear them in the shower?
Generally, you shouldn't.
Okay.
Because
All
they
right.
are electronic devices.
Yeah, that's what I would think.
So I would probably avoid using them when exposed to any water.
That would be scary.
Yeah.
All right, we are out of time. Thank you so much for watching North of 60. If you want any information about visiting Dr. Willen at Western Reserve Hospital, you know that you can always send me an email or and we will have that I'll have that information for you. Thank you so much for watching. Thank you for being
Thank you.
here.